the online series on creating a healthy work environment after COVID-19. Today we have with us, and I'm looking straight at him, Mr. Remo Kock. Remo is the Managing Director of SABA, but I would like to give him the opportunity to introduce himself and to introduce SABA to the public, what it stands for, what they do, before we get into the questions in terms of healthy work environment. Hi, Remo. Good to see
Hi,
you.
how are you doing? My name is Remo Kock. I've been working now 5 years as the Managing Director at the SABA. The SABA is basically a nursing home. We have been having a transition for about 9 years since Dr. Ninka Gonzalez-Smith came to SABA as the first doctor specialized in a nursing environment. And we have been transitioning from a elderly home around 2011 until the transition. We are now into a full-blown nursing home. And a lot of things are happening next to the COVID, not only the COVID, but also financial structure. What are we going to do for the future? Okay, since 2017, we have this system called the output subsidy, and basically we have to make sure that we have per patient a cost system set up that we can go to the government with or the asset fee and tell them, listen, for this category of a certain client, this is the money we need to make sure we have a certain level of quality that we can give to that particular client. And we are finishing up this week with a cost structure in which you have a cost category per type of client, not only for the customers within the SABA, but also for the, like they call them, the particuliere huizen, and or people that are at home and they need a certain amount of service or care, but they don't need to go to the hospital or they don't need to go to a nursing home. They can stay at home. And we're trying to get that all in perspective so we can go to the government and tell them, listen, this is what we see is necessary, not for the SABA only, but for the whole community in Aruba. Why? Because before people come to the certain nursing home, they will need help. Okay?
Yeah.
Everyone needs a certain amount of health care. And those levels are what we need to look at and see what is most efficient. How can we make the money we have, which ain't gonna grow, work the best for us, for the citizen? Okay. So, for example, if you have diabetes, you have a certain care with it. What kind of medicine do you need? What kind of care do you need? Where do you get that needs? And the more you get, the more complex it gets. How do you know for sure you get the best service for the amount of money available for the Aruban system? So we're going to that. So we're going to a lot of transitions, trying to figure out how to grow. At this moment, we have 226 beds. With the amount of people we have and the growth of people above 60, the amount of beds should go to 500. The question
That's a big number.
That's a big number. And the question is, if we are going to grow, in what kind of way we can do this transition? Are we going to do it in, like, for example, steps of 100? Does it need to be bigger? Are we going to work with departments, etc., etc.?
So, Remo, basically what you have been telling us or sharing with us is that SABA has been going through actually some major changes lately before COVID actually happening. But if you think about COVID itself, I'm pretty sure that has brought some additional changes to SABA. And I would like to ask you if you could share with us, based on your experience, because SABA is one of those organizations that has remained open throughout COVID, still open. And I'm sure you have some experiences that you can share with us, how that went for you. Can you tell us a little bit about that?
Yeah, sure. Basically, we are a 24/7 company organization.
Mm,
Our clients live with us. We don't get new customers, and there's a reason for that because of the COVID. We are at this point. We started closing our doors completely starting March 13, and up to this point, we have not one case of the COVID
mm,
virus, which is very good. But we
which
only
is
could
very good.
manage that because we had this, our security went up from one day to the next completely. We had an open door policy. Everyone could come in, but since we started on March 13, I think it was Friday the 13th, by the way,
I
we
know.
we put in. It took a weekend, but on Monday we started with security in the morning too. Gates were closed, and nobody came in. Clients, family could not come in anymore. Deliveries had to be done by calling in advance. Medicine and everything else was put in a protocol. We have this COVID protocol made by the crisis management team, and we sit now. In the beginning, it was 2 times a week. Now it's one time a week, and we sit and we discuss everything that has to do with the COVID. At the beginning, we had to do with regulations set in place by the Dienst Volksgezondheid and the
Yeah.
IFA, the Inspectie. And we came back to our people and said, okay, listen, this is what we need to work with. What works best for the SABA? And with whatever information we gave feedback to the people concerned, and then they could also see if this was something valuable for them. For example, we are a big organization, and when we say something, they listen. So a lot of times they take our advice and take that to the small houses, the particuliere huizen. And that's something that is good because we need to be on one level of security and management of whatever it has to do with the client. And
Can
we are
can
very
I
clear to that.
can I jump in a minute?
Yes.
It's you know how that when it comes to elderly care, it's kind of like a soft spot for me. And
Mhm.
it's yeah, it is. Like most of us, because you had mentioned before that Aruba, it's very community, we still take care of our parents in one
Mhm.
way or the other. It's pretty sure that what SABA does is very close to the heart of a lot of people here in Aruba.
Mhm.
And one of the, I assume that one of the challenges is that while taking the decision to close, so that other people could not, like even family members could not go and see their loved ones, that
No.
this would have brought up some challenges as
Yes.
well for you. How did you go about that, if I may ask?
Well, what we did is that we got sponsored about 12 pads, and what we did is that people could still connect with their family members through these tablets we got, or through phone, and then they can use Skype or WhatsApp or Blue Jeans or Zoom,
Mhm.
and still get connected with their family members. That's what we're doing, and it's working. We had to invest in Wi-Fi. We didn't have Wi-Fi in all the right places to get our customers going, so we had to invest in that. We did that, and people are very happy with that because they can still see
Good.
their family members. And if they want to meet face to face, what we do is that we set up a meeting next to the gates where they still cannot come in, but they can see their
Okay.
father or mother or uncle or whoever on the other side of the gate, and they can talk face to face. So we also make sure that we can handle that, And people like that, so they come to the gate and they talk to their family member, and they still see each other face to face, even though there's a gate in between, but still, it makes it workable. And people understand. Family members understand because they know that we are keeping their own family member, their own mother and father safe because we have these restrictions, and we want to keep it like that. We want to keep them as healthy as possible within the nursing home. So we're
No,
doing that.
I'm very happy. Personally, I must say that I'm very happy to hear that because SABA, it's all about care. And also happy to hear in between that you receive some sponsorships because SABA is a nonprofit organization, and generally speaking, that would bring up some challenges as well in
Yes,
terms of the resources that you have. And if talking about resources, when it comes to your people, so the people that have been working at SABA 24 hours a day, taking care of our people, let's put it that way, it must have been challenging for them as well as your colleagues.
yes.
What are some things that you could say from experience that you notice that employers can do, whether they are in the healthcare, whether they are in nonprofit or for profits? What can they do to, based on your experiences, what are some suggestions that you can give them in terms of, yeah, dealing or supporting their employees through this process? Can you give us an insight on this from on your experience?
Well, one of the things that we did that made our employees feel safer is to make sure that we had all these hand wash stations in place, and dispensers, and we have our doctors walking around talking to them, and whenever they have a question about the COVID and how we handle things, and the management teams, that we talk to them, we take it seriously. If we can do something with it, we will. And one of the things that we also did is that we have a social worker who we just put up a poster that if people are still worried and or they have mental issues, that they can go to this lady and they can talk to her and bring up the things, and maybe she can help with that, and because it's something that we do with the crisis management team. We sit
Okay.
together and say, what is something that we need to tackle, something that is a concern within the organization. Sometimes it's about, okay, what is COVID really about? And what are the myths? What are the facts? And we have our doctor, who is also part of the quality team, who
Okay.
goes around and in small groups talk to them, and they can ask her any questions about it. And then we have the social worker who goes to them if there are concerns about their own health, mental health, or there are friction within a group. She can also take care of that. She can sit down with them, have individual talks, or talk in teams. And that's the way we try to make sure that everyone feels that they are being taken seriously. And we also have our care managers who are actually the head of the departments
Mm-hmm.
on every single department within the locations. And they also talk constantly with our people. And we also tell them when you go home, take care. You have to take care, like you do at work. Make sure you have the social distancing. Make sure you take care of yourself because if you become sick, you have to stay at home. You have to
Yeah.
quarantine yourself for those 14 days because we cannot have those people near our clients. So we constantly are talking to these people, our employees, making sure that they stay fit, they stay focused, and that whatever we need to take care within the departments, within the locations to keep them safe, that we do that. And that's why we are very strict with having people come in, having family members come in, or
Mm-hmm.
even other, let's say, contractors also not come in if not necessary. Sometimes you cannot not have them come in because you have work to do. You know,
Yeah.
I mean, we are a 24/7 service, so keeps things will break down, and you need to take care of that. You know,
Yeah.
so there
Yeah.
are exceptions, but yeah, we have to make sure that the place is kept going, basically.
One of the things in terms of the place kept going that you had mentioned before, and yeah, moving into the new direction that SABA is going, that quite sure that you're looking at new processes, new procedures, new protocols, new way of doing business as
Right.
business applies to you. With lessons learned from now, are there anything that you can say that you either it's being done right now? Because in terms of, let's me put it this way, when it comes to new process and procedures,
Hmm.
um, it's challenging for people to accept change, let's put it that
Hmm.
way.
Right.
And but it's something that needs to be done. It was
Hmm.
not it was a complete surprise, this COVID, for
Hmm.
everyone, that actually put us in situations where change needed to happen and happened.
Hmm.
The portion about the part of, because the part of helping people, helping your colleagues as an organization understand that yes, these are the things that have to happen. um, what are some tips that you can give others in terms of, yes, this is a good way to go about making those changes happen?
Well, one of the things that we tell our people is that um, things might be opening up,
Hmm.
but there's going to be a new wave of COVID. That's for sure.
Yeah.
Like
Hmm.
all the flus in the past, you have waves, and they're expecting to be like three waves to come or two, depends.
Yeah.
But that means that certain things you have to be stricter with, like hygiene measurements that you took, okay, you have to keep them. If you can keep the social distancing, keep it going. People will get accustomed to it. Our people within are accustomed to it already. They are
Yeah.
aware of it. Our clients from the Symphony Memoria, the Memory Center, they're going to start coming back. But we put stickers on the floor, where to walk, keep your distance, um, just to make sure that they are aware that certain rules that were not applied in the past will be kept, and we will keep those rules. Even though there's no more COVID after this, hygiene, hand hygiene will stay in place. All right. And I also tell people, when you go to your car and you came from somewhere, a supermarket or the bank or whatever, you go to your car, have a little bottle of alcohol with you or hand
Okay.
sanitizer. Sanitize it before you step in your car. Those are small things to protect yourself. And we need to keep that going. Before COVID, I was like that already. You know, I came into my car,
Yeah.
I sanitized my hands before
I
I
can
started
see
my
that.
car. You know, but that's me. You know, I'm just atypical. But it's those are things that you can tell people, keep safe.
Yeah.
And for someone who manages a department or a organization, once you have certain things in place, people will get accustomed to it. Like for example, the dispensers we have near the entrances, people come in, they press, they don't even think about it. I mean, they press,
Mm.
they do their hands, and they continue. It's starting to be the new normal. And a lot of times that's the way to go. You can talk a lot, but build in the process within your system. And then it's not
Yeah.
going to be a problem. And it's going to
No.
take time, but people
Mm.
want to be safe. Most of us have our parents. Okay, my dad is at home. All right, I didn't go to him yet because he's like, keep away, yeah, keep your distance, and I respect that. Yeah, he's almost 80. So those are
Yeah.
things that you need to take into consideration and see how people take it and work with that.
No.
What do they expect and what do they want and how can you meet them halfway? and make sure that they see that you take them seriously.
I'm happy to hear that SABA has everything in place and it's taking care of their people so they can take care of our people. Let's put it
Exactly.
this way.
Exactly.
Before we go today or before we leave today, Remo, because you had spoken about sponsorship, it is a nonprofit. If people want to find out more about SABA, and I think this is a
Mm-hmm.
opportune moment to know because SABA is pretty big as an
Right.
organization.
Right.
Where can they go to get more information about SABA in terms of care for their family members or loved ones, or even for those who are interested in sponsorships, in helping out? Where can they go to get in contact with you or find out more
They
information?
Yeah, they can go to two places basically. They can go to Facebook, and we have our messenger service. They can always message or put a message on the messenger service, or they go to our websites. And I have it here, by the way, for people to see.
Excellent. Hmm.
So,
Great.
and they can always go to, most people go to Facebook, to tell you the truth. It's easier. We constantly have messages on there, videos of our clients, what we do with them. People like that. They see it's, we're trying to stay positive, and when they have questions, they put that on the Facebook page, and mostly I will get a message on my email, so it will
Okay.
get forwarded. So I would just tell people to do that. If you have a question or you want to help us, they can either do that, or they can call us on the telephone number stated on the website.
Great. Good to know. Remo, thank you so much for today. Thank you for your insights.
Thank you.
And thank you to everyone at SABA for the work that they do.
Thank
And
you.
have a great day. Thank you so
You too.
much.
All right. See you later. Bye-bye.
Goodbye.